The masseter, jaw jerk, reflex involves proprioception carried by the mandibular division of the trigeminal nerve to the mesencephalic nucleus, which activates the motor nucleus of the trigeminal nerve to contract the masseter, causing jaw closure. The trigeminal nerve has 4 nuclei. Motor nucleus, muscles of mastication, first pharyngeal arch. Mesencephalic sensory nucleus, proprioception. Main sensory nucleus, touch, vibration, corneal sensation. Spinal sensory nucleus, pain and temperature. The nucleus tractus solitarius, NTS, receives taste sensation, SVA. Pathways. Anterior to by 3 of tongue chorda tympani, facial nerve, NTS. Posterior 1 by 3 of tongue glossopharyngeal nerve, NTS. Epiglottis vagus nerve, NTS. The vagus nerve, 10, is the longest cranial nerve, supplying the head, neck, larynx, thorax, abdomen, kidneys, and upper ureter. It forms the vagus accessory complex with the cranial accessory nerve to supply muscles of the pharynx, palate, and larynx. Branches include meningeal branch, dura of posterior cranial fossa. Auricular, Alderman's, branch, external ear. Pharyngeal and laryngeal branches, palate, pharynx, larynx, carotid sinus, constrictors of the larynx.